The news today about the J&J vaccine. With me now, Dr. Amesh Adalja, a senior scholar at the Johns Hopkins University Center for Health Security. Dr. Adalja, nice to see you, sir. Welcome back.
Thank you for having me.
When you look at the efficacy of this Johnson & Johnson single shot, 66%, and of course, as I mentioned off the top, people look at that and they think about Moderna, they think about Pfizer, that's somewhere in the 90+ efficacy range, and think, well, that's not as good. What do you say to them?
I say that's not the right way to look at these vaccines. The reason why we developed a COVID-19 vaccine is to stop severe disease, to stop hospitalizations and stop deaths. And when you look at Johnson & Johnson, that vaccine looks very good, just like Moderna and Pfizer. I think we got spoiled a little bit with Moderna and Pfizer because of their high efficacy rates. But remember, a couple of months ago, the FDA would have approved something at 50%. So we're really doing really well with all of these vaccines. And I do think they are going to be the solution. So there should be nobody thinking that this is not good for Johnson & Johnson or not good for our vaccine rollout. This is something great, and people should get that vaccine. And it's a single-dose vaccine without a cold chain. That's going to be much more effective than a Pfizer vaccine sitting in a freezer that nobody can give.
If we are ever at a point when we are fortunate enough to be able to choose between vaccines, Pfizer, Moderna, Johnson & Johnson, which would you choose?
Well, I didn't have a choice. I got the Pfizer vaccine because I was a healthcare worker. But I do think that you're going to have to look at each individual person and see what are their risk factors for disease. You're going to have to find some way to do some head-to-head comparisons. We know people with Pfizer vaccine have allergies, so there may be some issues there. And it might be that certain vaccines are better for certain subgroups. I think we're going to have to do some studies to determine that. We give different flu vaccines to elderly people versus children. The same thing might happen. But obviously, people are going to look at the number and say the Pfizer and the Moderna vaccines are more effective. So everything else being equal, you would pick that. But remember, those are two-dose vaccines, and Johnson & Johnson, you're one and done. So I think it's hard to make that kind of a decision, and I think each person is going to pick differently.
What about all these new variants, Dr. Adalja? I mean, we've obviously talked a lot about the UK variant, the South Africa variant. There's a variant in Los Angeles. Are these vaccines going to work against all these various virus mutations?
So it depends on the variant. It looks like the UK variant is handled pretty well by our vaccines. The South African and Brazilian ones might be a little bit difficult. We don't really know much about the California variant. But the important point to look at is not the number of symptomatic infections that are prevented, but do the vaccines prevent severe disease from these variants? And that looks like it's the case. If you look at the Novavax data, which came out yesterday, if you look at the Johnson & Johnson data, they may not be able to block you from being infected, but they block you from dying. They block you from being hospitalized. So that's very good. And we can think about updating vaccines if that's necessary. But the key to stopping these variants is to get our population as vaccinated as possible so they have nowhere to spread. Even with reduced efficacy, the variant is not going to have an easy time if our vaccination rates go up higher. So this really should underscore the need to really accelerate at basically no speed limit for this vaccine into people's arms.
Good. We have also heard today from the governor of New York saying that starting Valentine's Day, New York City restaurants will actually be allowed to reopen, just capacity at 25%. This, of course, while schools are not even fully open. How can this be done safely?
I think that with lower capacity requirements, with people having to wear face coverings, with a lot of kind of mitigation efforts in place, a 25% capacity is probably not going to be a major issue. I do think it has to be the default, though, that schools should be open first everywhere we talk about. But I do think that restaurants have done a lot to try and make their environment safer. And in many places, they weren't driving spread. In certain places, they were driving spread. But it's important to try and help restaurants kind of reduce the harm the virus causes by kind of following a harm reduction approach and giving them tools to make things safer. And I do think this is something that can be done safely if mitigation efforts are put into place.
And I should be specific when I say 25%, of course, I mean indoor dining. Right now you can sit outside and freeze under a heater outside, but this would then open up the possibility for some people dining inside. And then also, Dr. Adalja, as you and I have been chatting, that we've been looking at live pictures of President Biden. He's been touring this vaccination site. Here he is at Walter Reed Medical Center. He is pushing to reopen schools in his first 100 days in office, right? That's a promise that he has made. Dr. Fauci now says that may not happen. What do you think needs to happen to make that a reality? Or do you think it's just still unsafe right now?
I think, and this has been my position through the whole entire time of the pandemic, that schools were something that should have been open much earlier than they have been. They should be, just like the CDC director said today, the first things to open, the last things to close. They should be the default. It shouldn't be that we work on opening casinos but not opening schools. And it shouldn't be the fact that schools are open for wrestling practice but not for calculus. I think that's kind of a switch priority we have in our country. So I do think the data shows that schools can be open safely if they're following the mitigation measures, if they're potting students, if they have face covering policies, if they've got social distancing. It's not them sitting in the classroom that's driving classes. It's sometimes the extracurricular activities like clandestine homecoming dances or sports after school. So I do think that this is something we need to do. I think that this should be the default. This is what it goes on in the European countries. Schools are open while everything else is closed, but we've kind of done it backwards, and I think that children are suffering, and the data is on our side for those of us who want to open schools.
I hear you. I think some of this, though, is majorly, contingent upon this $1.9 trillion COVID relief bill that this administration and some of these Democrats would like to pass. So it gets sticky. We're going to talk to a member of Congress about that in just a little bit. Dr. Amesh Adalja, thank you so much.
Thank you.